To log into Dragon, double-click on the blue flame Dragon Medical One desktop icon. However, prior to launching Dragon, make sure that your microphone is plugged in. Update the user ID with your network credentials. If you are using the PowerMic handheld, make sure Microphone PowerMic NS is selected from the microphone pick list. If you're using the PowerMic mobile phone app, make sure Nuance PowerMic Mobile is selected. You also have the option to choose from 13 different vocabulary specialties, in which you can select from the pick list respectively. Regardless of the specialty logged in with, you still have the option to train in custom words or phrases if there are any misrecognition issues. Once all fields have been populated correctly, click OK to log in. It is always best practices to launch Dragon before launching your EHR. Once you log in, your Dragon toolbar will display. This toolbar is in a permanent float mode, and you can drag and drop it anywhere on the screen to get it out of the way. On the toolbar, you have your microphone status indicator. It will be red when the microphone is not engaged and green when it is engaged. You have the login name of your user, your sound volume indicator, your application minimizer icon, and your Dragon icon, which launches the options menu, including log off and exit Dragon. If this is your first time opening your Dragon Medical One profile, there are a couple of options that we need to set up. From the Dragon icon, select Options, navigate to the dictation box section, check Keep text on the clipboard after transferring, navigate to the microphone buttons section, and update your checkmark button to display Accept Defaults. Click Apply All, and then Close to save your changes. The first time you turn your microphone on, you may also receive a Dragon tutorial pop-up. Feel free to just close out of that window to proceed with our training session. If you are using PowerMic Mobile, you will see the smartphone icon within your microphone status indicator. To use PowerMic Mobile, tap the Dictate button in your phone app to turn your microphone on, and then tap it again to turn the microphone off. When the microphone is engaged, the Dictate button on your phone app will be a solid teal color with white outlines. Speak into the bottom microphone area on your smartphone. If you are using the PowerMic handheld and you accidentally logged in with the incorrect microphone option, log off from the Dragon icon. Wait for the splash screen to reappear and update the microphone pick list. Click OK to log back in. Notice my microphone status indicator now displays a microphone icon rather. When your microphone is engaged, you will also have activity indicator, which are those dots circling the microphone. For specific use of Dragon within Athena, Google Chrome is a preferred browser. The Google Chrome extension for Dragon Medical One should be installed. Check your Chrome toolbar for the black flame extension. If you do not see it there, use the Chrome extension QRG for help installing this extension before using Dragon Medical One. Log into Athena normally and select a patient to document on. As a rule of thumb, any text field in Athena where you can type with your keyboard, you can also dictate into with Dragon. Notice that even though you are logged into Dragon, you still have full functionality of your mouse and keyboard. Click to place your cursor into the appropriate text field within Athena, and use your microphone record button to turn your microphone on to dictate into the field. The patient was recently hospitalized for CHF exacerbation and was discharged with increased medications, period. However, he did not fill his prescriptions and came back with persistent shortness of breath on exertion only, period. Scratch that. On exertion and on rest, period. New paragraph. He has history of orthopnea and PND, period. He has gained a few pounds of weight but denied to have any palpitation, pre-syncope or syncope, period. Always remember when dictating to speak in long, natural phrases without pausing between words if possible. Avoid proper names such as patient names by using the patient or he or she rather. To differentiate between regular dictation and a Dragon command, make sure to pause before and after stating the command name. Insert after wait. Since his last visit. End of field. Patient was seen by Dr. Frisch in the past, period. Correct Dr. Frisch. Choose 2. Click as normal to move on to the next section in Athena. If you do not have the Dragon Medical One Chrome extension installed, or if you do not make sure that your cursor is in a text field before dictating, the dictation box will launch to capture your dictation. If this happens, just continue your dictation as normal, and when you are done, you can use the Transfer Text button to move it over into Athena. For example, positive for right upper quadrant pain, period. He has occasional nausea, but no vomiting, period. His appetite has decreased, period. No joint pain, TIA, seizure or syncope, period. Other review of systems is unremarkable, period. New paragraph. I reviewed his past medical history, past surgical history, and family history, period. Simply click where you would like that dictation to go, and the left arrow is your transfer text. If you stumble upon phrases that you use frequently within your documentation, you have the ability to save them as auto text within Dragon. Just highlight the verbiage that you would like to save and use the command, make that in auto text. Make that in auto text. Name the command with a key leading word, such as my. Click Apply All to save. Then close the Manage Auto Text window and try it out. New paragraph. My histories. Scratch that. You can also manage your auto text from the Dragon icon. Anything that you have built will be alphabetized on the left-hand side. You can also create new from this window by clicking the plus sign button in the lower left-hand corner. Single-click any auto text from that list to view or update. If you build in a left and right bracket into your text content, Dragon recognizes these as variable fields. These variable fields can have a single word or phrase in between, or be blank. Now, let me show you how these variable fields work. My physical exam. If Dragon sees a left and right bracket, it will automatically highlight the first instance. If any of that verbiage or that field needs to be updated, simply dictate over the top of it to change. The arrows on your microphone are set to the commands next field and previous field so that you can press them to jump through your brackets. Sepal period, jugular venous distension 5 centimeters above the clavicle present period, no thyromegaly period. %. Insert after cyanosis period. A 1 plus edema present period. When you are done changing any of the content necessary, hitting the check mark button on your power mic will remove any remaining brackets. You can also use Dragon in any search fields. Hypertension. You must, however, hit the space bar on your keyboard to have the list update appropriately. If you would rather say a command than have to press your space key, we can build a command for that. Click your Dragon icon and select Manage Step-by-Step Commands. Click the plus sign to add new. We're going to call this Search. Click the new step bar and select Press Hotkey. In this text field, if your cursor is present, just press the space bar on your keyboard and the field will capture it. Click Apply All and close to test it out. Hypertension, search, non-ischemic cardiomyopathy, search, branch vessel coronary artery disease, search, the patient has hypertension, non-ischemic cardiomyopathy, and branch vessel coronary artery disease, period. Clinically, he is in NYHA class 3, period. He has some volume overload and was not, unfortunately, taking Lasix as prescribed, period. I've advised him to take Lasix 40 milligrams POBID, period. I also increased the dose of hydralazine from 75 milligrams TID to 100 milligrams TID, period. I advised him to continue to take toprol and lisinopril, period. I have also added aldactone 25 milligrams PO daily for survival advantage, period. I encouraged him to find a primary care provider, period. He will come for a BMP check in 1 week, period. I asked him to check his blood pressure and weight, period. I discussed medication changes and gave him an updated list, period. I have asked him to see a gastroenterologist for hepatitis C, period. At this point, his Medicaid is pending, period. He has no insurance and finds it hard to find a primary care provider, period. I recommended Dr. Shi, period. I will see him in 1 month, period. He will have his fasting lipid profile, AST, and ALT checked in 1 week, period. Proofreading my dictation, I noticed that Dragon misrecognized Dr. Shi. To train in this vocabulary word, I'm going to use my correct command. Correct Dr. Chi. I do not see the correct spelling in my menu options this time, so I'm going to say add that to vocabulary. Add that to vocabulary. In this window, update the text field to display the correct spelling of your vocabulary word, and click the red microphone button to train it acoustically. When you click the red microphone button with your cursor, it will automatically turn on your microphone. Make sure that you dictate your word naturally and do not over-enunciate. Dr. Shi, in some situations, you may be prompted for a pronunciation. Click Confirm to save. And then return to your dictation to try it again. Dr. Shi. If you click your dragon icon and select Manage Vocabulary, you will see your newly added words. You can also add new custom vocabulary words from this window. Clicking the plus sign will get you back to that same Add Word screen. We used the audio recording option earlier, but you also have the option to use default pronunciation if the word that you're training is phonetically pronounced as it is spelled, or the Enter Word as you pronounce it link, where you type in a phonetic spelling or abbreviation of the word, such as an acronym. Click Save. Dragon cannot learn mistakes if you just use the keyboard to backspace and type over misrecognitions. You must use these correction and training tools to improve the accuracy of your profile. Insert after 1 month at ASH. If needed, there are a couple of reference windows built into your Dragon profile as well, such as, what can I say? This command launches a menu containing categories for help in navigating, formatting, managing auto text, commands, correction, navigation, and help. From your Dragon icon, there is also a help menu. This launches an external window that includes step-by-step instruction for using some Dragon functionality and processes. And last but not least, before you close out of Athena, make sure you also close out of Dragon properly. From your Dragon icon, select Exit.